expressed on this program are not necessarily those of WTJX's board, staff, or underwriters.
Good day. You are listening to Ability Radio. I am one of your hosts, Amelia Hedley-Lamont of the Disability Rights Center of the Virgin Islands. And today we have a very special guest, as we do most of the time. Today we have Kalyn Fahie, who is a training and technical assistance manager for an organization called Ujima. Ujima is the National Center on Violence Against Women in the Black community. Kalyn, welcome to the show. I'm so happy to have you here today. How are you?
I'm great. Thank you for having me. I appreciate it.
Now, I understand that you work as an advocate. You're also an author and a human resource professional, and that's a lot of skill sets. Tell us a little bit about yourself and what brought you to this kind of work.
Well, what brought me to this work, I was working as a human resource administrator for a hospital and an HMO when I lived in Detroit, Michigan. And while I worked there, I had already survived domestic violence myself. Mm-hmm. And while I was there, I met people on the job and I saw how domestic violence affected them, but not only them, but how it affected their coworkers that were concerned, coworkers that was complaining because this person was missing days because of domestic violence. I saw how it affected the company. I saw how it affected the employees getting garnished their wages because the abuser was taking their card and charging things on it without their authorization and things of that nature. So it was really, God told me to start an organization in Detroit in 2006. So I started this organization called Sisters Acquiring Financial Empowerment that actually still exists in Detroit. My oldest daughter, who's 30, is now leading that organization. Mm-hmm. And so I did the work and directly helped thousands of survivors of domestic violence in Detroit. What happened was the work that I was doing was really specifically around economic justice for survivors of domestic violence. How do you seek work if you're being stalked?
Right.
So the word got out nationally around this woman is doing this great work helping survivors of domestic violence overcome economic abuse, actually at that time during the economic downturn in the country. And so if she's able to help them during this time with survivors who are facing these type of challenges, then we want her to come speak here or help us with this project here, or we need her to consult. And so that's how that was really my entry into doing the work nationally. And so I was doing it for years, speaking, teaching, training, doing the work, direct services. And then I had an amazing opportunity to move to St. Thomas in 2016.
Okay. Tell us about that.
Well, I met a local guy and we ended up getting married. And so I moved here in 2016. It's a long story, but I'll spare you from that now. So I moved here in 2016, and then I started working for the territorial-wide coalition, DVSAC, the Virgin Islands Domestic Violence and Sexual Assault Coalition. Mm-hmm. Every state has a territorial or state coalition. So I was able to work on a state level or territorial level here for 4.5 years. It was an amazing opportunity for me to really learn about the needs around the Virgin Islands and the support that was needed, and to be able to extend my own expertise in helping others to strengthen their capacity to help survivors of domestic violence. I did a lot of work with the churches, with government organizations, and things of that nature. So that was really good. And then in 2022, I got the opportunity to work for Ujima and manage some programs, including grant programs. We grant other organizations funding to do work in their communities around domestic violence and sexual assault, specifically in the Black community or other culturally specific communities. So it's really been really these opportunities for growth, for me to help, for me to support. I'm really excited about this work and where it's taking me.
Well, okay. First of all, Ujima is located on the website, which is ujimacommunity.org. And I noticed on its homepage, it's a future where Black women and girls are safe, respected, and thriving. So what are some techniques or suggestions you could make to any person out there who is a victim of domestic abuse or domestic violence?
So speaking directly to the victims that might be listening, or somebody who isn't even sure, like, I don't even know if this situation is toxic.
Right.
I don't know if I would call it domestic violence.
Mm-hmm.
And they might not be sure what kind of situation you're in. Just know that I believe you and that you can lead your own destiny and where you want to go from here. I don't want you to feel like you're stuck in the situation. There are people and programs, even locally in the territory. You have the Women's Coalition of St. Croix, and then you have the Family Resource Center on St. Thomas and St. John. These programs are here to help you, navigate your next steps. You can also visit ujimacommunity.org for resources and suggestions. And then there's another website called the hotline.org. That's the National Domestic Violence Hotline that has a lot of fact sheets and information and tools that you could look at, like quizzes like, is this going on with me? Is this going on with me? You can also talk to counselors at any of these programs, specifically, the programs here in the territory, to kind of talk through it and say, okay, this is what's going on with me. Just because you talk to somebody doesn't mean that you have to now go to shelter, that you have to make a move. I just need to talk to someone through this situation so I can figure out what my next steps are. Maybe your next steps are you want to stay. That's fine. We can help keep you safe where you are. You can start thinking of strategies and things to keep yourself safe, and we can help you with that as well.
So it's called thehotline.org?
That's the National Domestic Violence Hotline. It's just thehotline.org.
Okay.
And then, you can always also contact the Women's Coalition of St. Croix and Family Resource Center on St. Thomas and St. John as well.
No.
And then Ujima Community, we have resources on our site as
now,
well.
You mentioned that you were, or I don't know if you still are a member of the Domestic Violence Council, right? DVSAC, we pronounce it. What I'm trying to figure out is, what is the distinction? How do you distinguish the work of what DVSAC does versus the Women's Coalition or the Family Resource Center?
That's a really good question. So the domestic violence work is it starts on the national level. Then the national level guides what happens on the state level. Not what happens, but kind of guides the conversation, provides training, resources, information, works on policy issues, helps to provide funding, and advocates for grant funding. Then you have every single state and territory has a state coalition. There you have staff that work on policies, issues that affect the entire state. They are to provide information, resources. They then should train other people in how to do the work. Talk to community. So on the state level, on the coalition level or DVSAC level, they didn't provide direct services to survivors. They help within systems to improve things for survivors. For example, there was some work being done a while back to improve the crime victims compensation fund. So when survivors go to the hospital to get survivors of rape go to the hospital to get a rape kit that is paid for in a timely manner, things of that nature. That's actually work that still needs to continue.
Right.
And then under the state program would be the direct service provider. So that's Women's Coalition and Family Resource Center, who actually work directly with survivors on a day-to-day basis that they could call 24 hours in emergency. So that's the difference between the programs. Unfortunately, currently in the territory, DVSAC is no longer registered as a state domestic violence and sexual assault territory. So there is a gap in those services in the territory.
Okay. So you're saying with respect to setting policy or providing guidance to, people who make decisions on a political level, we don't have an entity right now that's empowered to do that? Other than the direct service providers.
The training and the technical assistance to the local programs and to other, emerging programs, to government agencies, to, youth programs that might want information about, teen dating violence. Like those are all the churches that will want information about how do we help, people in our church that has and then we would work directly like with the pastors, with the other leadership of the church to train them. That organization, DVSAC, is not currently in operation.
Which brings us, I guess, to you, right?
Yeah.
Because it seems like you now have the task of providing, thankfully, training and technical assistance to our community as a result of your work with Ujima. So let's talk a little bit about that, because your focus there, or your position there, as I understand it, is as an assistant manager for the organization. Is that correct?
Actually, the senior manager of training and technical assistance. I do want to say that we are not trying to replace the territory.
Oh, no, of course not.
And so what we actually, are looking at, how can we support bringing something back to the territory? Or something else. What does the territory want? So we held a series of listening sessions in conjunction, and we presented a report to the Department of Health and Human Services in regards to what the territory went to all 3 islands and talked to a couple hundred people around what does people in the territory want to in this next version of a territorial-wide coalition.
So what are your impressions of those meetings?
Well, the people were extremely passionate, and we had a great representation from seniors to, there was even a few teenagers, people that worked in the field, that worked for the hospital, the police, emergency programs, etc., to just people that were like, I'm sick of this. People who were survivors who were very concerned. And from that cross-section of people throughout the territory, they were all very, very concerned about the state of things. Some of the people didn't even know that DVSAC had closed. And they were just coming to the meeting because they were concerned about domestic violence in general. So what the general consensus is that the people here want something. They want they want increased services. They want better solutions. And they're very frustrated.
Right. One of the things that you mentioned, which is so important, is the importance of financial empowerment. I mean, I think that's really, quite honestly, as I understand it, a basis for what, why a person might stay or, stay in a relationship. What are some factors that Sisters Acquiring Financial Empowerment, or SAFE, has guided individuals who are in resources? What kind of financial tools and resources are needed to help an individual, recover from the economic portions of domestic violence?
It's a multi-layered approach, and it also intertwines with the other, really looking at the other levels of domestic violence. And I'll give you an example. So here in the territory, you might have people who are isolated from friends and family, but the abuser might take them from one island and bring them here to the Virgin Islands and then take their passport. So now, how can I make money? I don't even have my ID. And this abuser has now removed me from my support system. So now we're really starting from scratch. Like, how do you navigate that? How to help them get an ID? How can we connect you with work opportunities? To get you, if you wanted to work, if you want to return to school. So thinking about these different things, how do you look for a job if you're being stalked?
Right.
How do you create a resume if you might have gaps in your employment due to abuse? So really troubleshooting on a customized basis, on a one-to-one basis, based on what that survivor needs and what they want in their life. So really looking at their goals, having real conversations with them around what is it that you want in your life? How can we support you, versus me putting my expectations on you? We're not trying to be the abuser in your life again. Right. So we want to lead where you want to go. And so that's some of the key points. And, really looking at budgeting, but budgeting from a realistic view. Sometimes in a more costly specific way, allowing people to put in their budget things that are important to them. Faith-based giving might be important to you. Now, if you go to another program, they'll say, oh, well, don't give your money to a church. You need the money to survive. But if you feel like that is a part of your recovery and that's something that's important to you in your faith, how can we support you with that? So that's just, an example. Somebody might say, okay, I want a beer every week. We're not here to judge you about that. We need to, if you put that in your budget, then you need to understand that, okay, well, we need to shift some stuff around, or you might not have something in another area, but we aren't judging.
That's very important. It's very significant. I'm glad you brought that out. There are other programs that is part of the Ujima organization. One of the things I noticed was culturally specific service programs that improves, say, the response if an individual has to call for emergency assistance. I'm curious what you would say, or what do we mean by a culturally specific response, or by improving responses? Now, again, we're a predominantly Black community, but I'm curious as to whether, there's a distinction, say, here in the Virgin Islands versus stateside. I was trying to grapple with that. Tell me more about that.
And I think that was one of the challenges that previous iterations of this work in the territory hadn't really embraced that. They were more afraid of saying, well, we want to service everybody. We can't just say we're custody specific. But saying that you're custody specific doesn't exclude everybody. Mm-hmm. You could still service everyone, but you could say, okay, if a person comes to me and they want to speak in a language that they shouldn't have to code switch to receive service.
Right.
So if you want to come and you want to talk about VEX money, you want to talk about this person, melee, like I should understand these terms if I'm providing culturally specific services for you. So language access is one. Two, how is it done? If we are saying, okay, in our community, people work 2 and 3 jobs.
Yep.
If we want to really provide services for people, then we really need to think about 24-hour access. And Family Resource Center and Women's Coalition, they're good with 24-hour access. But that's important because people, might be getting off a job at midnight and need resources and services then.
Right.
Same as we need to, maybe even not having your program during the daytime, having it at night when people get off work. What kind of food? And okay, we say we're going to provide food and refreshments. What are we providing? Are we providing things that people consider a meal, or things that locally people might just consider a snack? Just,
Yes.
What I'm saying?
Yes, I do.
If we're really going to help the people, like if you don't know how people are coming, they might not have eaten all day, and you're telling them that we're going to give you dinner, and then they get there and they're getting a slice of pizza. Right. Locally, that is not considered dinner at all.
Right. Right.
And that can be very disappointing, disheartening. You might have said, bring your kids, we're going to feed the family. And then everybody's hungry. Right. So thinking about the culture as a whole, all the parts, how do we move? How do we talk? What's important to us? What are our values? That's what you have to infuse in the services that you provide.
Right. Right. Well said. Well said. One of the things I also saw, a statistic from the Ujima website, was 2022 statistic in which 1 in 4 Black women and girls are murdered every day in the United States.
Yes. Yes. This desstatistic is real. And this is why I'm personally so passionate about the work that I do. I've been to a funeral of a victim of domestic violence. That victim was in Detroit, and that victim was a volunteer of the organization that I started. She was a sponsor. And so she was a person who actually gave us money, who gave resources to the organization, and she presented herself so polished. And I never once thought to say, if you're in a situation, we can help you just because you're helping us. I never even thought she was in a situation. That really opened my eyes to how domestic violence doesn't discriminate. Right. And we always, people can say these words, but if you close your eyes and you think about what does a survivor of domestic violence look like, you might have a picture in your mind of a middle-aged person with a whole bunch of kids, low income, all of these stereotypes. And that's not the case. It affects on so many levels. And this is why the numbers are so high, because it doesn't discriminate. You have senior citizens who've been in domestic violence situations for 40-something years. The kids will say, oh, well, they used to fight when they were younger, but they don't fight anymore. But meanwhile, the abuser is holding the victim's medication from them and not taking them to doctor's appointments and calling them names. So they're not physically able to fight because they're older, but the abuse is still present.
Wow. You've created an imagery that is very broadening and enlightening at the same time. So, these are things to be mindful of for sure. One of the other things you mentioned is building the capacity of Black programs. Give us some examples of that, please.
So the first step that Ujima really works for building these programs is through funding. So we have a couple of grant programs if you are a nonprofit or not even a nonprofit. If you're a community organization that's interested in learning about our grant programs, visit ujimacommunity.org. But funding is a big part of it. The second part is in regards to infrastructure. So helping with technical assistance, which is also under my area, helping organizations and advocates and emerging advocates, people that are interested in doing the work. How do we increase your capacity to actually do this work in a trauma-informed way? Mm-hmm. So that would be through our training, one-on-one, talking to you about your organization, helping you with things like board development, policies, things you might need to, or things you haven't thought about. And so I have free office hours for technical assistance to try to go through a consultation and do some consulting with people every week. And it's free of charge through Ujima.
Okay. So tell us about how you are providing services here on island in the U.S. Virgin Islands. What does that, what does it involve?
Well, in addition to the things that I mentioned, we also have a robust research and policy development and a legal department as well. Mm-hmm. So currently on island, just a person that people know that do the work. So mm-hmm. people will call me, WhatsApp, connect with me for assistance. The other way is I'm really advocating for additional services back to the community. So I'm advocating to the federal government, to our own organization, because I'm here. I live here. This is my home. Right. So I need these services here. Right. And so I'm advocating for that to happen. And I'm really, extending myself to help with this because it's so important.
If somebody wants to reach you through, your work through Ujima, what's the best way to contact you?
My email address is just so long. I will give you my cell phone number. So you could just call me, WhatsApp, 313-492-8069. That's my area code is 313, is still Detroit, 313-492-8069. I never worry about giving my number out because I will block you if you're a weirdo. So.
And that's a very easy thing to do.
Yes, it is.
You kind of touched upon this before, but I think it would be helpful for our audience to know, what kind of things can a person do to protect themselves, a survivor of, a very bad situation at home?
So the very first thing that you have to do is do not tell anyone that you're thinking about leaving, that you're going to do anything. Mm-hmm. And because it could get really heated. Yeah. You're in the middle of an argument and you're like, this is why I'm leaving, or I'm going to go, or I'm leaving you. And what happens is, domestic violence is not about love. I love you too much. It's not about a heat of passion. It's not because somebody was high. It's plenty of people that's high. They don't abuse people. Mm-hmm. About one person intentionally wanting to control another person. That's it. It's about power and control. So what happens is, if you reveal that you're leaving or you're making these plans, or that's why I'm going to get a job and save my money so I could go, then now this person, the abuser, now feels like they've lost some control. And so they'll escalate their efforts to control you. Mm-hmm. This is where the homicides go in, when things start to escalate. You may have to keep this information confidential from your children. Not that, or in your family, your mother, and not that they have any intention or ill intention, but abusers are conniving, they're manipulative, they can be very charming, they can extract information. And so just to keep yourself safe, keep that information confidential. Feel confident in reaching out to programs and services that can help you, walk you through a safety plan. You can even look online and search domestic violence safety plans to get an outline of what that process might be like as well.
Okay, so the safety plan could be found at, say, one of the places you mentioned before was the hotline, the hotline.org, correct?
The hotline, ujimacommunity.org. And then Women's Coalition of St. Croix and the Family Resource Center of St. John and St. Thomas can also walk you through. They have counselors that can walk you through the safety planning process.
Excellent. Excellent. I am very impressed with, it seems like you've learned a lot.
Yes. I'm a survivor. I survived domestic violence way back in 1998. And I was injured to the point where I had to get reconstructive facial surgery. I had my left eye socket was completely shattered. I have a titanium implant there that replaced the bone. And it was extremely hard for me to recover mentally, emotionally, physically, financially, even in my faith. It was a challenge. And I do not want anyone to go through anything like that ever again. When I went to the woman's funeral who passed, I said, I never want to go to another survivor's funeral again. And these are the things that motivate me.
Well, no, and I appreciate you sharing this story with us. Really, I mean, I commend you for the work that you're doing on behalf of, us, all of us, women and girls.
And I also want to say, that domestic violence does affect all genders.
Yes.
So, because people often say that, well, what about everyone else? I'm not negating anyone else. That was just my thought at the time, that I wanted to help all women. Through this conversation, I've just really referred to victims and abusers without using gender. We support anyone who's been victimized.
No, I agree. And I also respect the fact that you provide support, or your mindset is to provide support for a person without judgments as to what decisions that individual makes. That is such an important component. All right. We only have about a minute left. Is there something that you'd like to bring to our attention? Again, we're going to repeat how to reach Kalyn Fahie, 313-492-8069. Anything else you'd like to leave us with in the few seconds we have left?
I just want everybody to be encouraged, know that help is available. Raise your voice. Let the politicians know that you want more support around domestic violence in the territory, that you want more funding and resources to go towards programs that do this work in our territory.
Well, listen, I'd like to thank you so much for sharing your personal story, your professional story, and the movement, quite honestly, to effect change on behalf of women and girls and men and boys, anyone who is a victim of domestic violence. Thank you, Kalyn Fahie, who's with Ujima, Inc. This has been Ability Radio. And again, your host, Amelia Hedley-Lamont. Thanks so much for joining us. Have a good day.
The views expressed on this program are not necessarily those of WTJX, its board, staff, or underwriters.